The presenters today are Dr. Molly Lopez and I. Dr. Molly Lopez is the director of the Texas Institute for Excellence in Mental Health, or we call it TIMH for short, at the University of Texas at Austin, and I'm the senior program coordinator for school-based mental health at the South-Southwest Mental Health Technology Transfer Center, which is housed within TIMH. And Molly will tell you all about that center when she begins.
Welcome, everyone. Thank you so much for joining us in this first webinar in the series. We're excited to get started with this opportunity. So we wanted to give you a little bit of information. Make sure I'm able to move my slide. Of course, we have our traditional acknowledgments. The work that we're doing for this webinar series is through a grant that we've received from the Substance Abuse and Mental Health Services Administration. And a little what we're going to cover today. So we're going to really briefly introduce you to the Technology Transfer Center Network, which is the umbrella in which we're doing this work, and then launch into really trying to provide some information about what a comprehensive school mental health system looks like. Then we'll shift over to talk a little bit about the different roles that community mental health partners can play in that comprehensive system. Then we want to shift a little bit and think about what a school's wish list might be for partners. So you, as potential partners or existing partners, can think a little bit about what you might want to do to get set up to be the best partner you can. We'll have some time for questions and answers at the end, and then we'll do a quick preview of the upcoming webinars that we'll be doing in this series. And then at the final, we'll make sure and give you information on how to sign in to do the survey and to get your CEU. So a little bit about this thing we're calling TTCs. It's called the Technology Transfer Center. And this is an initiative by SAMHSA to try and provide regional technical assistance organizations across the United States and even in other countries. And so SAMHSA's decided that they really think that the opportunity to have regional expertise and offer trainings and technical assistance in that way is going to be beneficial. So the purpose of these TTCs is to develop and strengthen the behavioral health workforce as well as the primary healthcare workforce as it relates to substance use prevention, mental health prevention, and then treatment and recovery supports in those two domains. And we also have the opportunity to really help organizations incorporate effective or evidence-based practices into their systems, again, across the spectrum of prevention, promotion, intervention, and recovery support. So here's a quick model of how we're thinking about this work that we're doing. Some of the work will be done at what we think of as a universal level. So this is opportunities to share information, to conduct webinars, to offer kind of high-level universal training to providers. And then we have what we're thinking of as more targeted technical assistance. And this is really where the training may go up a level, and we are thinking about not just training, but support for developing competency and skills in that technique and really incorporating those practices within our service systems. And then lastly, at the highest level, we have intensive technical assistance. And this is really the opportunity for us to work with organizations and with systems to really do some transformational work. So, for example, an organization that may be interested in doing a more broad trauma-informed care transformation, which we know has many complicated parts to it. So we have that opportunity of working at all of these levels, which is really exciting. So here is the umbrella under which the different TTCs fall. So what you should know is that you have in your region the opportunity to get the support from an addiction technology transfer center, the mental health TTC, that's us, as well as a prevention TTC, which is under the substance use prevention component of SAMHSA. In addition, we have what we're calling like a cousin, which is the SMI advisor. They are also within the same time frame, kind of new to the structure, and they provide clinical support for providers who are working with individuals with serious mental illness. Here's a quick map with the different mental health TTCs across the country. So you'll see we're down there in Region 6, and we cover Texas, Oklahoma, New Mexico, Arkansas, and Louisiana. But one of the really exciting things about this work is that we have at our disposal a wide array of expertise across all of these different MHTTCs. So while we may not have a particular expertise that may be needed in our region, we can call upon the many different diverse organizations who are serving in this role in their regions of the country as well. And by that nature, that means that you have access to those resources as well. So here's a quick picture of all of our staff members right now. Hopefully you know some of us and have worked with us before. And you get to hear a little bit from me and a little bit from Michelle today. Oops, okay, with that, we're going to launch into kind of our initial discussion about what a comprehensive school mental health system looks like. Here's some of our objectives of what we're hoping to do today. We know that you are not the ones responsible for developing comprehensive school mental health systems. So we are approaching this as kind of recognizing that you all are key partners in that system. And as you look to partner or to enhance the current partnerships you have, how can we help understand the lingo of school mental health? What are the terms, the acronyms, the things that are bounced around that you want to come in with knowing so that you're talking the language at least to the largest degree you can as you enter that system. We also want to give you a chance to kind of understand the characteristics of the best practices in school mental health. You know, you all have worked a lot around evidence-based practices in mental health systems, and the way that school mental health looks, it can be kind of different. So really thinking about what are those best practices, what does a comprehensive, high-quality mental health system look like, so that you have that vision as you enter school systems. We also want to spend a little time thinking about the different ways that community mental health partners can contribute to that school mental health system, the different roles that can be played, and to give you some information to help you consider about how best to approach potential partnerships or enhancing potential partnerships with schools. And with that, I'm going to kick it over to Michelle so she can get us started.
So, comprehensive school mental health systems provide a full array of supports and services that promote positive school climate, social emotional learning, and mental health and well-being while reducing the prevalence and severity of mental illness. Comprehensive school mental health systems are built on a strong foundation of district and school professionals, including administrators, educators, and specialized instructional support personnel, such as school psychologists, school social workers, school counselors, school nurses, and other school health professionals, in strategic partnership with students, families, and community health and mental health partners. These systems also assess and address the social and environmental factors that impact mental health, including public policies and social norms that shape mental health outcomes. Effective, comprehensive school mental health systems contribute to improved student and school outcomes, including greater academic success, reduced exclusionary discipline practices, improved school climate and safety, and enhanced student social, emotional, behavioral functioning. And just give me a minute. When we switch users, it takes a minute for Zoom to understand that the users have switched, and I can't switch my slide.
Would you like me to switch it, Michelle?
Yeah.
Me and my family and all my friends I love so much.
Okay. Core features. There are several core features of comprehensive school mental health systems. Each of these will be examined in more depth here and throughout the training. So educators and student instructional support personnel, collaboration and teaming, multi-tiered system of supports, evidence-informed services and supports, cultural responsiveness and equity, data-driven decision-making. Okay. All right. It is important to have a full array of school and district professionals, including specialized instructional support personnel that are well trained to support the mental health needs of students in the school setting. District and school professionals are the foundation of comprehensive school mental health systems. Administrators and educators need to be trained in how to promote student mental health and to identify and refer students in need of extra mental health support. Student instructional support personnel include a variety of professionals trained to support student mental health in the school context. Again, these include school psychologists, school counselors, school social workers, school nurses, and other health professionals. And you'll find a variety of these types of support personnel in various schools within Texas. When community providers partner with schools, they should be augmenting existing supports and services in a strategic and integrated way, instead of replacing or being walled off from school professionals. Collaboration and teaming between students, families, schools, community partners, policymakers, funders, and providers addresses the interconnected academic, social, emotional, and behavioral needs of all students. Okay. Students and families should be involved in all levels of school mental health systems, including planning, development, implementation, evaluation, and training. There are several ways that students and families can be involved in school mental health systems. Okay. Next slide. Okay. Some examples of the way that families and students can be involved in the school mental health systems include participation in a school community advisory group, involvement in the needs assessment process and program selection, involvement in developing family-centered procedures for mental health referral, service provision, follow-up, and crisis care, development of communications about school mental health services to students and families, evaluating programs and communicating results to parents, communities, and funders. In addition, there is good research to show that students have better outcomes in school and in mental health treatment when families are engaged, as I'm sure you know. Community mental health partnerships. Partnerships between schools and community mental health organizations are purposeful and designed to augment the abilities of schools to integrate student mental health into education. Community partners can help to augment services within the school building and can link students to other services and supports in the community. In addition, they can help to champion what schools are doing to support mental health with key leadership, including boards of education and policymakers. Successful and sustainable school mental health systems integrate partners to complement the mental health supports and services offered by districts and schools. The roles and responsibilities of school and community partners will differ based on unique needs and resources of the schools and the communities they serve. In many schools, community partners are integrated across all tiers of support, but are primarily involved in more intensive treatment supports for youth with identified mental health challenges. All right, the multi-tiered systems of supports, or what we call MTSS. This is a full array of tiered evidence-based processes, policies, and practices called a multi-tiered system of supports, which promotes mental health and reduces the prevalence and severity of mental illness. Based on principles of prevention, the tiers of support layer on one another so that students with higher level needs continue to receive supports that promote positive mental health among all students. Many schools deliver instructional or behavioral intervention to students in varying intensities as part of the MTSS to address the academic needs of the larger student body and not just students with identified disabilities. Based on a public health framework, prevention is an underlying principle at all three tiers, with Tier 1 focused on promoting mental health and preventing occurrences of problems, Tier 2 preventing risk factors or early onset problems from progressing, and Tier 3 individually intervening to address more serious concerns that impact student daily functioning. Matching the range of academic, behavioral, and social needs with the school involves the layering of interventions from universal approaches to targeted programming for students with mild impairment, and for some students, adding on individualized interventions linked to the lower tiered structures. The MTSS approach ensures that all students may access this full service array, including the students in both general and special education, and that all students will have exposure to universal mental health supports. The number of tiers in an MTSS can vary, though many districts employ a three-tiered model. Mental health promotion services and supports, Tier 1, are mental health related activities, including promotion of positive social, emotional, and behavioral skills and well-being, which are designed to meet the needs of all students, regardless of whether or not they are at risk for mental health problems. These activities might also include efforts to support positive school climate and staff well-being. These activities can be implemented school-wide, at the grade level, and/or at the classroom level. Examples include a school-wide trauma-sensitive school practice approach, or grade level or classroom presentations for all students, regardless of whether or not they are at risk for mental health problems. Early intervention services and supports, Tier 2, to address mental health concerns are provided for students who have been identified through needs assessments, screening, referral, or other school teaming processes as experiencing mild distress, functional impairment, or being at risk for a given problem or concern. When problems are identified early and supports put in place, positive youth development is promoted and problems can be eliminated or reduced. Examples include small group interventions for students identified with similar needs, such as chronically absent students, brief individualized interventions, such as motivational interviewing and problem solving, mentoring, and low-intensity classroom-based supports, such as a daily report card or daily teacher check-in. Treatment services and supports, Tier 3, to address mental health concerns are provided for students who are already experiencing significant distress and functional impairment. Examples include individual, group, or family therapy for students who have identified and often diagnosed social, emotional, and/or behavioral needs. Some things to consider when implementing a multi-tiered system of support include the needed supports and services should be fluid. As you know, students need different levels of supports at different times throughout their development. The tiers should be layered. Students who receive higher levels of support continue to benefit from universal mental health promotion supports. And definitely invest in prevention and mental health promotion. Effective mental health promotion, Tier 1 supports can reduce the degree of need for higher level supports in a school or a district. Okay. Implementing evidence-based practices and emerging best practices enhances the quality of the supports and services provided to students. It is important that services and supports that are backed by scientific and/or practice-based evidence of implementation success are achieving the desired outcomes. Teams need a system in place to evaluate the evidence for any service or support being considered or already being provided. Ongoing monitoring of implementation success is crucial for continuous quality improvement. Decisions about which services are most likely to benefit individual students are grounded in systematic, reliable data. There are many sources of evidence to refer to when developing and implementing your school mental health system. Research-based evidence and practice-based evidence is equally of value for districts to consider. Overall, it is imperative that districts have a strong commitment to continuous quality improvement, which can include referring to the evidence on a regular basis to make decisions. In all aspects of a comprehensive school mental health system, it is critical to consider and be responsive to the specific cultural values, beliefs, and behaviors of families and communities, and to ensure access to mental health supports and services in a manner that is equitable and reduces disparities across all students. Stigma, cultural adaptations of evidence-based practices, reducing health disparities and disproportionality, meaningful family partnerships representing all families, and cultural competence are considered in all aspects of comprehensive school mental health services and supports. The collection and use of data and decision-making monitors students' needs and progress, assesses the quality of implementation, and evaluates the effectiveness of supports and services. Observations and other data and information should be used to make fair, objective decisions about identifying student mental health needs, matching students to appropriate services and supports, monitoring progress to evaluate student response to interventions, changing student services and supports over time as appropriate. Sources of data often available in schools include those you see here: mental health screenings and assessments, which you may play a part in helping schools select the screenings and assessments to use, school climate surveys, grades, attendance sheets, seat time sheets, performance test scores, office referrals, suspensions and expulsions numbers, achievement or benchmark test scores, behavioral observations, and crisis incidents. Schools in Texas will vary widely in the amount and type of mental health services they are currently offering. Some may offer none currently, while some may have been connected to a community mental health partner offering services for a very long time. Schools that are new to school mental health may not be aware that the MTSS structure that they're using is also used to offer mental health services, and that community health providers can be integrated into their campus teams. Community health partners can play an integral role in helping schools build comprehensive school mental health approaches that meet both the school's and the agency's goals.
You will probably notice that the model that Michelle talked about really resembles the public health approach to and sorry. Okay. And that you'll see a lot of similarities. So as you think about kind of universal approaches within the health field, within the school setting, they have universal approaches as well to supporting mental health and to promoting good mental health, both of the students as well as the staff within the system, et cetera. So you'll see a lot of similarities. You will also hear different acronyms, different titles put on those different multi-tiered systems of support, but they frequently have the same general components in it. So you may have heard things like positive behavioral supports or positive behavioral interventions and supports, PBIS. You may hear things like RTI, response to intervention. Those are other ways of looking at that multi-tiered system to support students in the community. So now we want to shift a little bit and focus on what community partners can do and the role that they can play within the school mental health system. So one of the first and very important roles is community partners can participate on district or campus teams. As Michelle mentioned, having a strong team to really guide the decision-making at the school about what's going to be involved at each of those tiers is an important critical element to that quality of care. And so within high-quality MTSSs, they are involving not only school staff, but also community partners on that team. So what is a team? A team of school and community stakeholders that can happen both at the campus level as well as at the district level. And that team will meet regularly. They'll gather that data that Michelle talked about. They'll use that data to determine what the students and staff in their school or district most need. They'll use that data to identify what evidence-based practices they want to implement, and then they'll use it as well to conduct their action planning and to identify whether or not students and staff are making progress in the areas that they want them to do. So you'll see different terms used to describe the school mental health teams. You may hear about a school climate team. You may hear about student support teams, or you may have tier teams, maybe a team focused on that mental health promotion level or on tier 2 and tier 3s. You may also hear about district mental health leadership teams. And probably many of us, of course, have heard about school health advisory committees that may also play a part of a role, at least in advising some of this work that's happening at the district and campus level. So be aware it comes in many different teams, but you're looking for a team that's focused on those tiers, supporting school mental health, and using some of those high-quality practices. So examples of team activities, they may conduct a needs assessment. That means identifying with their data what are the highest priority needs within their campus or their district, because we know that a good school mental health system needs to really address the problems, the issues, and the needs of their particular campus. They will also look at developing a resource map, and that's identifying both the internal resources that are within their school, campus, or district, as well as the resources within the broader community. And you'll hear in future webinars, folks talk about the ecosystem network, which is another way of thinking about what resources are available to our campuses to address school mental health issues. They would identify evidence-based practices that are going to meet those identified needs, and as Michelle talked about, walk through a really structured way of making decisions about what those evidence-based practices should be. They may also work on addressing particular issues around the system. For example, identifying referral processes that work as they identify students and point them into both internal and external services and supports. They may work to develop warm handoff processes so that families who are being referred, especially externally to the school campus, have an opportunity to have a good experience with that referral. We know that it's important to foster good communication among different stakeholders who may be involved in a child support. And so developing those communication channels and making sure we've worked through any policies and procedures that need to be addressed. And then really importantly, they will work to track and monitor student progress and use that information in that Plan, Do, Study, Act way to identify whether or not different practices are really addressing the needs that are there in their community. So as you think about your role as a community mental health partner, there are many aspects of these team activities that you can play an important and critical role. And our local mental health authorities are very skilled at doing many of these activities, at identifying evidence-based practices, at using data to guide decision-making, and at working through issues of referrals and warm handoffs. And so there's a lot of expertise that can be offered to schools who may be newer at trying to figure out this activity. So a second role that community mental health partners can play is to support professional development within the schools. This may be a role that you are already engaged in some ways, but there may be opportunities to expand and enhance that. So examples of these kind of activities, one is to conduct teacher or staff workshops. I suspect that many community mental health providers already do some of that, but really having a structured way that addresses the specific needs that are identified in that school mental health team through staff workshops and support. We certainly know that youth mental health first aid is a big effort in our state, and that local mental health authorities are playing an important role in that. But really thinking about additional, maybe even more advanced skills and supports that can be provided to teachers and other staff within that school setting. In addition, a really important role that partners can play is as a consultant to school staff. We know that individual teachers may struggle with particular challenges within their classrooms, and community mental health providers have that opportunity to do things like do observations, or perhaps with children that they are specifically working with, provide guidance and coaching to school staff about how best to address behavioral or emotional problems within their classroom in a way that's most supportive to the student and family. In addition, community mental health providers can support teacher wellness activities. We know that the wellness of teachers and of other school staff is really critical to creating a good learning environment where kids can really blossom and have strong emotional health. And so providing opportunities to support teacher wellness is an important component of that. Schools can also participate as a part of a critical incident response approach. We know that within individual schools, things happen that may heighten the opportunity for trauma or distress within school communities. And community mental health centers are frequently well-trained in how to approach the aftermath of such an incident in a way that supports recovery and wellness and reduces the likelihood of trauma within the organization. And lastly, one other example is that community mental health providers can advise on school policies and practices that really promote school mental health and help schools think about how best to institute some of their activities in really strong policies. So role 3 is the one we probably most frequently think about, and that is providing school-based mental health services. So in a lot of our work, I know we think a lot about integrated healthcare and how do we integrate mental health within the healthcare system. And we talk a lot in that realm about the different levels of integration that can happen. And that same sort of different structures is in place when we think about schools as well. So certainly mental health providers who are employed by external organizations can provide services on the school campus, and that can be done in a way that is more of a co-location way, as well as a way that is truly integrated into the comprehensive system. So some types of activities that are included in this role, providers can support Tier 1 services. So as we think about those opportunities to really address broadly our school mental health promotion, examples of that might be helping to coach a school in becoming trauma sensitive, helping them understand how, as an organization, they can support creating a really trauma-sensitive school. And another example might be to provide family strengthening or family resilience workshops available to all families within that system. In addition, providers can certainly provide Tier 2 and Tier 3 services. So examples of some of those activities might be running a social skills group within the school campus, or offering a trauma and loss group to students. And certainly providing individual counseling and the opportunity to address crisis incidents on campus are important aspects as well. These are probably some of the areas that you're currently working with campuses and districts on, but really thinking about the full continuum of care and what might be your role in that. And I want to recognize that organizations may not be able to play a role in all of the different tiers of services. There may not be financial support and an organizational structure that supports that, and that is okay. But we want you to understand the different ways in which you could play a role so you can make some really concrete decisions about how you think your role in the school or the campus might make the most sense. So the fourth role we wanted to talk about is the role in coordinating community-based services. So we know that not all mental health services and supports may be able to be provided on the school campus, And so there's some opportunities to work with schools to really coordinate well between the school and community-based services. So some examples of activities in this role might be to really be the responsible party for coordinating intensive community-based services among various systems. So one example of that might be a wraparound approach to care in which the community mental health provider plays a key role in making sure that all of those stakeholders who are involved in the child and the family's life, including natural supports and other family, are on the same page about the current needs that are being approached and the different strategies that can be used to help address some of these needs. So certainly working with the school to understand their role and the different strategies that they can use to ensure that the child and family are successful within the school environment. In addition, community mental health providers can provide specialty mental health programs that the organization may need to link to. So we know that schools and campuses are not going to be able to provide some of these specialized services, such as coordinated specialty care for early onset or first episode psychosis. And so working closely with the schools to help them identify if those issues arise and how to link with those specialized services. In addition, one of the challenges that schools really face is helping to support transition of students who have been hospitalized or who may have had a mental health crisis, and to really think about how to help most successfully transition that youth back into the campus. And community mental health providers can play a key role in helping to support that transition. So we wanted to take a little bit of time to think about what a school or district may be wishing for as they think about who they want to partner with. This is tough work, and so schools are likely thinking about what partners should I outreach to that I'm going to have the best success with. And they have to make some conscious decisions about that, especially in more urban areas where there may be more partners that they can partner with. They may decide not to partner with all of the mental health providers within their region and may decide to be more specific, such as putting out an RFA or creating MOUs with organizations that they want to work most closely with. So some of the things that a school or district may be really thinking about is this provider willing to participate on our school mental health team? Frequently, there is not specific funding for that sort of participation. And it is very beneficial, of course, to the schools to have those providers participate. It helps them plan for that coordinated effort and really ensure that things are working smoothly to have active participants. Schools also need to think about what levels of that multi-tiered system those providers can address. So as they identify their needs in tiers 1, 2, and 3, what are the providers that can help support the programs that we want to put in place? And kind of tied to that, since we've talked about how important it is for schools to provide those evidence-based services and supports, if they have provider partners that are already utilizing evidence-based practices, then that is kind of a win-win for both. Also, we talked about how important data was to school mental health teams. It helps guide them in making decisions and understanding whether or not the services that they're offering are being helpful. And so having provider partners that can collect and report data is very important. So some of the elements that may be of interest is productivity, the impact on both psychosocial functioning, but academic functioning as well, and understanding student and family satisfaction, engagement, and care. In addition, as we mentioned, having provider partners that are willing to participate in professional development or supervision of on-campus staff can also be very beneficial. In addition, thinking about how those community partners engage families in leadership roles. Since the school is really working to develop family partnerships in their school mental health system. Having provider partners that are open and experienced in engaging families in those decision-making roles is also very helpful. Then thinking about the opportunity to provide in-home and clinic-based services, so an array of community-based options, highly identifying those providers who are recommended by the parents who are seeing people in the community, as well as by other community members. So having a strong reputation in the community as a solid partner and as a good source for services is really important. And then, of course, we're not talking very much about financing in this webinar, but it's certainly very beneficial to have providers who can use both Medicaid, private insurance, and have other funding sources to supplement what other funding might be available within the schools. And then last but not least, kind of understanding the school system and having experiences providing services in schools is very beneficial. And we're hoping to kind of at least give folks a little bit of that through this webinar system. Again, hoping to make sure you can talk the talk and sort of understand what schools are being approached to do as they launch into this work or expand their current work on comprehensive school mental health systems. All right, I'm going to turn it back to Michelle to lead us through some.
For all of us? No, because not.
Hi everyone, you're now all unmuted, so you'll need to look for the icon on the bottom left of your screen that says it has a microphone to mute yourself again, unless you have a question. Does anybody have a question for us? Please also feel free to type in a question via the chat box if you'd rather not voice a question at this time.
Let me throw out a question to you all, get us used to talking a bit. Are you seeing in the campus and districts that you are working with that folks are talking about these tiered systems of support and that they have school mental health teams?
Hi, my name is Dora. Are you able to hear me?
Yes, hi Dora.
Hi. Yes, actually, I can answer that question. Maybe a question of mine can be answered too. We just started, so we do have a program inside 2 schools, and we're working and collaborating with them. I think I was looking at the tiers, we kind of, or I personally feel like what happens when or how can we filter through when it feels like a lot of it is coming in and I guess students feel more like they're tier 3. And so we're like, I don't want to say the word overwhelmed, but there's so much need that we didn't expect. And so now it's kind of like we're trying to, I guess, be able to reach out to those in tier 1 and even potentially try to even start something, I guess, now in like that lower, like the professional development and the support, now that we've kind of got through the summer and we survived our first year. Because it did feel, I guess, now that we're collaborating with the school, we're seeing like the high need and all these kids that the teachers and even, nurses and principals didn't know what to do, and they had kind of no resources. And as soon as we came in, it was kind of like here is a whole bunch of list of kids. And so we kind of got caught up in that. And so that matches up with what y'all described in tier 3. And so I guess now my question is I guess more on the tier 1, how can we do that? Or I was taking notes on some of the ideas, and I think the mental health first aid is one of the things we've done so far to try to kind of provide that support and start that up for this school year. I don't know if anyone else has done anything out there that they can share. I don't think I like the coaching idea. I can see how teachers might need more of that one-on-one, and how can maybe if another like mental health, you know, I don't know, clinician out there can kind of see like how do we balance the offering that support while still offering the support to our own clients.
Yeah, that is a great question. And I'm going to make a comment first, and then we'll open it up to others if they'd like to kind of add to your plea. I think probably what you are seeing, and it seems to be very common, is as mental health support providers come on board, really the focus becomes tier 2 and tier 3. And what a lot of experts will say is it's really important to start with tier 1 and have a really strong base, because that may, if you have a really strong base at tier 1, that may address 50% of the need that you're seeing right now in tier 3. You know, if those students have a lot of strong support within the schools for the different structures that they might need, they won't necessarily make it up the pathway to your tier 2 and tier 3. And similarly, tier 2 becomes sort of that early intervention component. A strong tier 2 will also help reduce some of the tier 3. So as much as you can encourage your schools to start looking at what some of their largest needs are, and start planning about how they may implement some best practices at tier 1, you may see a lot of reduction in some of the activities that you're seeing right now in tier 3. And of course, that's better and less stigmatizing for young people as well, if those are able to be addressed in the lower levels of care. I want to see if anybody else has any thoughts for Dora based on their experience. Well, Dora, please know you're definitely not alone. It's a common problem.
Well, thanks. Yeah, we just started the program, and so we're fresh. It's 1 year, but I can see how it's very needed and how much it worked. While we did kind of get, you know, a lot of those referrals on the tier 3, I think like when y'all were talking about like, you know, gathering the information, we started doing that, and a lot more of like the crisis stuff was prevented because there was so much more collaboration going on. So we did kind of start, so I like the whole idea of like getting surveys out and for families, and maybe there's something that they can provide. And the climate survey, I thought that was another one. We kind of did start doing the attendance one and the referral one, kind of start tracking where we're at, and you know, kind of move things around if need to. And well, I mean, I'm going to take this suggestion, the roles for community partners, because you're right. I think if we were able to address some of the tier 1 stuff, it's just going to kind of, you know, reduce a lot of the tier 2 and 3.
And feel free to reach out when, you know, if your team starts to, you know, want to figure out what different practices they may want to consider at tier 1. We'd certainly be happy to have more conversations and see if we can help you out.
Thank you.
Awesome. Okay, I think, see if I have control. Okay, well, we wanted to give you a little bit of information about the upcoming webinars so you know what to expect. Our next webinar will be the State of the State, where we'll have the opportunity to hear from the Texas Education Agency and the Health and Human Services Commission about some of the work being done to improve school mental health systems. There's been some exciting things that have happened this legislative session, and there's a lot of work being done around this area, and so we want you to be able to hear from them about all of that. Following that, we'll have a webinar about understanding school culture, where we'll get to hear a little bit about kind of, again, what it might be useful to know about how schools work and what's important to them. We will talk a little bit about some of the challenges to partnership. We want to kind of help dive in a little bit on some of the things that folks frequently hear, like we can't share information, and kids can't be taken out of class, they'll lose instructional time, and really dive into some potential solutions for some of those barriers. Then we will have a webinar about building the case for school mental health partnerships. What you might do to kind of talk with schools who maybe are still in those early phases of thinking about their role with school mental health to make the case. We'll get to hear from some communities who are doing this work right now about what are some of their lessons learned for that. We'll also have a webinar about some best practices in school mental health, again, sharing some of the lessons learned from community mental health providers that are creating really strong partnerships with their schools and districts. And then our final webinar, we'd like to take an opportunity to do a shift and share, where folks on the webinar are able to talk a little bit about some of their school accomplishments as they partner with schools, as well as some of the challenges and barriers that they've experienced. So that will be a very interactive one, where we'll be reaching out to try and get folks to talk about some of what they are going through.